Is Mucuna pruriens only for the poor? Mucuna grows wild where the poor cannot afford Sinemet. There it is, the only option for people with Parkinson's, so no one argues against its use. I am Dr. Maldonado, a neurologist specializing in Parkinson's disease. I have an academic background and use conventional treatments, but I keep an open mind to unorthodox options. The best one is Mucuna pruriens, a tropical legume with naturally occurring levodopa, the same gold standard in Sinemet or Madopar. Many patients who use Mucuna have been disappointed by a recent interview with Dr. Roberto Cilia, a renowned neurologist whom I follow and admire. He discourages the use of Mucuna in Western countries. However, he strongly supports it in poorer regions where synthetic levodopa is prohibitively expensive or hard to obtain. In broad terms, I agree with his position with some important nuances to consider. First and foremost, Mucuna works. Famous neurologists such as Warren Olino and Andrew Lees are the ones who have registered Mucuna extracts as a treatment for Parkinson's patients. In various small clinical and observational studies, patients have often reported improvements in motor symptoms that are comparable to or better than those achieved with standard levodopa, carbidopa formulations, Sinemet, or Madopar. And even without scientific protocols, Mucuna has been used safely and effectively in traditional medicine for more than 2,000 years. For nations where incomes are low and access to medications is scarce, Mucuna pruriens is a lifeline by three primary reasons. 1. Cost of synthetic levodopa. Standard PD drugs like Sinemet or Madopar may be priced well beyond the average monthly salary, making them unaffordable. 2. Abundant local supply. Mucuna grows spontaneously in many tropical climates, and local harvesting can provide a natural, cost-effective source of levodopa. 3. Evidence-based necessity. In such circumstances, arguing against Mucuna would be short-sighted. If it's the only realistic option for many patients, then it fulfills a critical therapeutic need. That said, the situation changes in Western or more affluent nations where synthetic levodopa is readily available. Dr. Cilia's stance, that Mucuna isn't recommended in these settings, stems from practical and regulatory considerations. 1. Poor quality control. Mucuna products found on the market often provide scant information about their composition. Labels may not always match what's inside the bottle, with levodopa concentrations fluctuating wildly. 2. Risks due to dosage errors. Some batches may contain less than advertised, leading to underdosing. Others can have more, risking accidental overdosing and interactions. When combined with carbidopa or benzerazide, potentially quadrupling its effect. 3. Doctors are frequently unfamiliar with Mucuna or dismissive of it because it isn't part of standard treatment guidelines. In addition, because it's not officially recognized, prescribing it can carry professional and legal risks. 4. Enthusiastic patients who are intrigued by Mucuna often struggle to find a physician willing to guide them. 5. Without professional oversight, these patients rely on piecemeal advice from internet forums or personal testimonies, which can be incomplete or misleading. These are serious barriers, and they explain why many Western specialists prefer the tried-and-true route of prescribing synthetic levodopa formulations that have undergone rigorous quality control and standardization. Despite the obstacles, I believe there is still room for Mucuna in Western countries, provided we address the above limitations effectively and responsibly. Here are some proposals to ensure patient safety and well-being. 1. Look for trusted laboratories or suppliers that offer clear quality certificates, ideally with third-party testing. 2. Ensure they list the exact levodopa concentration in their capsules or powders. 3. favor products of low or medium concentration over ultra-concentrated ones because precise dosing is critical for levodopa therapy. 4. Search for a physician or advanced practitioner who is open-minded about alternative approaches and has studied Mucuna's properties. 5. Monitor therapy. A professional take the control with the patient, keep track of symptom changes, and adjust doses to avoid complications. 6. Patients should have a thorough understanding of both Mucuna's benefits and its risks, including potential side effects, drug interactions, and the importance of consistent dosing. Adequate information also arms the patient with realistic expectations and helps them avoid internet miracle cure pitfalls. When these measures are in place, Mucuna can be integrated safely and effectively into a broader Parkinson's treatment plan, complementing, not necessarily replacing, conventional medications. One of the most exciting developments on the horizon is Dr. Celia's multi-center trial in several low-income countries. This project will involve hundreds of patients with Parkinson's disease who will be systematically monitored while taking Mucuna. Positive results on efficacy and security of Mucuna should reinforce its position as a legitimate PD therapy worldwide, not just in resource-limited settings. Imagine an FDA-endorsed Mucuna formulation with guaranteed potency and purity. That might give doctors the legal and ethical backing they need to feel comfortable prescribing it, thus increasing patient access in wealthier countries as well. This will lead to the acceptance of Mucuna by the medical community in all countries, and I am sure will benefit people with Parkinson's disease. I have a dream. My dream is for all people suffering from Parkinson's disease, rich and poor, to have a powerful and safe Mucuna controlled by doctors.